Testing orthonasal and retronasal olfaction for the early detection of Parkinson's disease. So what are the symptoms of Parkinson's disease? So it's classically or clinically diagnosed by the motor symptoms, but there are also non-motor symptoms which can actually badly impact the quality of life. And we are interested in the loss of sense of smell here. But why though? It's because 90 to 96% of patients with Parkinson's suffer from anosmia, which is complete loss of sense of smell. And what's worse is that this can occur years before the onset of clinical symptoms or the motor symptoms. And interestingly, the pattern of smell loss in Parkinson's is different when compared to other diseases that also have smell loss as a symptom. Now, orthonasal and retronasal are the two routes of olfaction. Now, classically, orthonasal is the one that's mostly tested upon, especially in Parkinson's disease, and not retronasal. So what is orthonasal olfaction? It is when you smell something through your nose, which is what we do normally. So it is a very passive sense. But retronasal happens when you're eating or drinking something. So it happens from the oral cavity. So we need to know that oral cavity and the nasal cavity are connected by nasopharynx. And when you're eating or drinking something, the odor molecules travel from the back of the throat to the nasal cavity via the nasopharynx. Now, classically, the olfactory function testing is done with these marker pens that are called the sniffing sticks test. And they used to test the threshold, discrimination, and odor identification. Now, unfortunately, we cannot test retronasal with these pens because that's not unsanitary. That's not sanitary, sorry. So we decided to use these odor-containing glass bottles, which were specifically made for this study. And with these bottles, you can actually test both orthonasal and retronasal without having to worry about the unsanitary method. And before testing the patient population, that is the Parkinson's patients, we would like to test, or we are testing normosmic individuals, that is people with a normal sense of smell. And we truly believe that testing orthonasal and retronasal and seeing the difference could help with seeing the pattern of smell loss in Parkinson's in the future, and also it could help with the early detection of the disease, which would be a monumental stepstone in Parkinson's research. Thank you very much for listening.